What? I was the first time click.
That shit don't ever happen.
I know, right?
Ever.
It's standing on business for 2024.
That nigga need to make T-shirts on that shit. He need to coin that phrase.
Definitely, definitely.
He need to straight put in a patent for that shit.
Man. So how was your
What's
holiday?
happening? Not bad. Not too bad. New year. New stuff to deal with.
Yeah.
So chilling. Another day, another year.
How's the
So
family?
nobody
That's
good. Get
good.
on my damn nerves. The teenage kids, like,
Whew.
man.
It don't change when they become
Oh,
what are they, young adult? Mine are 21 and 20. So what's that? Young adults, young.
kids.
Yeah,
You still gonna be
it
kids
don't
and,
really,
and three man, kids.
it don't
2021.
change. And then my bonus ones are 22 and 26. Yeah,
Yeah. Long
yeah.
as they still saying mama.
Yep,
Same shit. Kids.
yep, definitely, no doubt.
Cause I'm scared. I'm scared to let these little Negroes off into the world. I'm like, man.
It's a different generation. I be hoping
Mm-mm.
the grandbaby generation will save the ones that's coming up now.
Mm-mm.
Cause I don't know. I ain't sure.
Yeah, this is it's scary. It's scary times. But no, they're
Definitely.
good. I'm blessed. I got good kids, man. They're not, you know, it could be so much worse. So I can't really trip.
I I feel you on that. It's the same
Yeah.
with me. Like mine are definitely still good kids, but it's just
Mm.
I don't know, the way we used to think versus the way they be thinking, it be different.
It's totally different. Oh, privileged ass shelter kids. You don't know. None-
All right. So you gotta pin
Nonetheless, let's get
your
to it.
information in the
Let
bottom.
me
Do
do it
that
now.
first. Welcome everybody. I see the numbers climbing. Welcome to the
So
first live for 2024. If this your first time, I see somebody say started following. If this your first time, welcome. You've been missing us for what, 2 years now? All right, so if you don't know who I am, I'm Cola Red. I'm one of many of Dr. P's patients. I underwent minimally invasive surgery to treat fibroids. And a lot of people were inspired by my journey and had a lot of questions about my specific journey and just health questions in general for women's health, general health, all that good stuff. And we started going live almost 2 years ago, and it's keeping it going, keeping giving out the free game, and definitely trying to help us get as many health concerns addressed as possible in this using social media for that platform. So without further ado, I have Dr. P here with me. Some of you all have submitted questions. If you want to join the live and ask a question for yourself, you can send a request and it will ask Dr. P to add you to our room. And then also, if you want to ask a question while you're here, there is a question bubble at the bottom of the screen if you're viewing it, and it has a question mark in it. If you could put it in there, that'll make it real easy, because as it's scrolling on the screen, it's hard for us to catch. Sometimes we see y'all comments and sometimes we don't, but it's easier if we put it all in there.
yeah.
Anything else you want to add?
No, that's it. Let's get into it. Like I said, don't be scared to hop up on here. Like if you got questions, like I said, it's
It's
free game. Like you
like a
get to
free consultation on the
free
spot.
consultation.
So
Cause they be I get everybody around. It's like, what if you just they ask me a whole big thing of questions in the DMs or whatever. Like, man, look, you got to schedule some time. I'm not about to sit up here and look at all these ultrasounds and all this stuff or whatever. I just don't have time for it. So if you want to talk about it now, you sure can
but
for a
this is the
reason.
free power hour.
This is the
And we
free
do it,
power hour, okay?
we do it what, once a month,
Yeah,
every 2 weeks, sometimes. It just depends
yeah,
on our schedule, coordinating it sometimes. But we always try to at least do once a month.
for sure.
So Before we start, though, I do want to clarify. So last month, for those of you who are here, we definitely ended on a bang. But the topic was reoccurring bacterial vaginosis, or reoccurring BV. So the person DM me, and I get triggered by that question, and I went a whole different direction than they question. So to clarify what their question was, and it was directed towards me, was have I experienced recurring BV as a result of having a hysterectomy? Because they had heard rumors that a hysterectomy can throw off your pH, or it can make, you have vaginal issues. So to clarify, I have not had any side effects with recurring BV post hysterectomy. So what you may have heard may have been a myth. BV and yeast infection pH are not the same thing. So that's why I was triggered about recurring BV. As I will always say, start process of elimination of what might be going on, because you should not recurringly get BV. It's not the same thing as sometimes you can have overactive yeast and all that kind of stuff. It's not the same thing. Am I right,
You
Dr.?
are correct.
I mean, you can get it, but it shouldn't be
So
recurring.
one thing that can happen too is people get a lot of misdiagnosis too, and I see that often. You know, you have to realize too, like when you go into an urgent care, or if you go into like one of these places, which I know people that can like chronically go into these places, they want to shut your mouth, right? You're coming in there complaining about something, and they want to give you something or do something so you can feel better at ease about whatever it is you came there for. And I see BV misdiagnosed so much. Um, and I see Flagell just thrown out like Skittles. You know, it's just a it's an overdiagnosed, misdiagnosed thing. So if it goes away on its own, like if you have an odor, like, and if you go scroll back, I did like, little posts and stuff about this that were funny. But if you have an odor, um, there are so many things that can cause an odor, but if it goes away on its own, that means it's not an infection. Anything that goes away on its own is not a problem or an infection, right? Things that can cause an odor. Sex. Why does sex do it? It doesn't mean he just gave you an infection. If you ejaculate inside, right? So semen is basic, right? There's an acidic environment in the vagina. Just like when you were in chemistry class as a fifth and sixth grader, you mix with an acid with a base, it smells like it's a big puff of smoke. It's the same thing. Like when you ejaculate inside the vagina, you'll have a few days of odor that happens that's not an infection, but it'll make you think it's an infection or there's a fishy type of odor, but it'll go away with over the next few days, right? And if that happens, it's not an infection. Other things that causes it, what I chronically see is, women come in and they would say, I was like earlier this month, it just smells so bad. And did it get better? Yeah, but I can't take it. Like something's wrong. I had vaginitis and I took, Flagyl or what have you. The other basic thing is blood, right? Blood is also basic. So before your period and after your period, in those immediate parts, the vaginal secretions are going to smell differently. Sometimes it stinks bad, sometimes it doesn't. But just note that whenever you have an acid and a base mixed together, you will have an odor. So don't freak out. Like the thing that you don't want to do is over medicate yourself. When you start to just take Flagyl after Flagyl after Flagyl, note that your body gets resistance. That's the problem with giving um this antibiotic over and over. Those antibiotics those bacteria get resistant, so you'll get a true vaginitis, and you try to take Flagyl and it's resistant to it because you over medicated yourself. And somebody just said just diet helps too. Huge thing, right? Think about it. The If you like eat, you know how like if you eat something that like kind of like your skin will permeate the same, like if you eat something bad, like it's the same thing with your vaginal secretions. I see women that get upset, like, where's this discharge and stuff coming from? How much water did you drink over the past week or 2 weeks, right? So your vaginal secretions are a direct result of how you're hydrated, right? It's really a product of the fluid that's in your blood cells, and that's where these vaginal secretions come from. So if you're dehydrated, you're going to have thicker, sometimes curdy, sometimes off-colored vaginal discharge, and it's not because of anything else. It's because you are dehydrated, or your diet is pure trash, and you're dehydrated. So it's like it's things that are very common that I see, which can cause vaginal discharge, cause vaginal odors, that people just automatically just prescribe antibiotics for, and it's doing you much more harm than it is good. So you got to be very, very careful about misdiagnosis of vaginal discharge and stuff.
Excellent. All right, so if you just joined, because I see the numbers are definitely changing and
Coming up.
climbing since we first started talking, you more than welcome to send a request to join the live if you want to ask your question in person, and you pretty much can go as deep as you want. It's a free consultation on the spot. And then if you want to drop a question in the chat, please use the question mark inside the comment bubble, because then we can keep track of them and I can mark off who asked what and
Yeah.
things like that.
And somebody said like there's a question I think, but I just wanted to talk about like real quick. They're making comments about boric acid. Like that's another overused, mismanaged medication. And you do not chronically take boric acid, right? Boric acid is when you have yeast infections that are resistant to common antifungal bacteria. I mean, antifungal medications, right? When I was in residency, like that boric acid was like the last line of defense when somebody just continued to have recurrent yeast infections. Gentian violet, boric acid, these are very heavy hitter medications. When these don't work, when they stop working, you stuck, mama. So if you chronically doing boric acid all the time, you can cause problems. But don't, people will argue and like say whatever. I'm just telling you what I know. Don't do it to yourself. But somebody tried to hop on. So we're gonna get to the questions. But we wanna be fair to people that are trying to hop on to the live first. So let's do that first.
Yep.
Um, if IG lets us be great. There we go.
There we go.
Well,
Welcome.
Welcome. Hello.
hi, how are you? I wasn't sure
Good.
it was turning, so
It's coming. You're
my
here.
first time joining a live, and
Hi.
Well,
I follow
Welcome.
Dr. P, Coach Jesse, all of that. So when I saw Dr. P's live on, I'm like, well, whatever he's saying, I want to hear it.
Awesome.
So I joined,
Awesome.
and now I'll be following you, Cola Red. This is my first time.
well,
But I
welcome.
have a question. I recently went to my GYN because I've been having really sharp pains, like, I would say 3 weeks out of the month leading up to my cycle.
Mm-hmm.
Mostly in the middle of the night, 4 a.m., waking me up out of my sleep, lasts about 20 minutes. So, I'm pacing the floor, like doing the Lamaze breathing, just trying to get past it. So I had ultrasounds
Mm-hmm.
done, and there were 3 fibroids noted, and they seem to be measuring small, 2.6, 2.9, 2.2,
Mm-hmm.
and then the other size is around 1.5, 1.7, 1.5.
Small.
And so the gynecologist said, well, it's not really large enough to do anything surgical,
Where are they
and
at?
just prescribed
Are
me Oh, okay. Go
Where
ahead.
they at? Did it say that they were located? Like, does anything say submucosal involvement or
It
endometrial cavity
says
involvement?
no endometrial contact
Awesome.
noted. And
Okay.
and then the third one, it says with a small amount of endometrial contact.
Okay.
Um, saying, cesarean section, scar, lower uterine segment, blah, blah, blah. But, and then it said there are additional fibroids in the uterus that are not well visible.
Okay.
So, what
So,
my
so,
doctor
so
told me was just take more pain pills,
I disagree. So
which is not
so,
what I want.
so when did you start having your pain? Like it just started, or has it been
No,
before?
you know what? If I had to calculate, I would say 2020.
Hmm.
I started having the pain. I went for ultrasounds back then. It was during COVID, and the doctor said, we don't see anything.
Hmm.
So, fast forward to now, these pains are like, waking me up out of my sleep. And
How often?
I would say daily around 2.5 to 3 weeks before my cycle. And then
Gotcha.
once my cycle happens, they calm down. And then about a week and a half, like this window, I don't have much pain at all. So that's where the
So
confusing
do
part
you do
is.
you or have you ever been on birth control or any hormone suppressants?
No, not for years. My son is
Gotcha.
23, and I haven't been on birth control
And
since he was born.
if you don't mind me asking, like how old are you?
I'm 46.
You're 46. Okay. Um, and so you have your appendix?
Yes.
Okay. Um, so and you said before 2020 it never really happened.
If I had, 2020, we were paying attention to a lot of stuff, and that's when I noticed it because that's when I talked to my previous GYN
Okay.
about it.
How are your periods? Like are they heavy? They painful?
No, they're heavy the first 2 days. I
Hmm.
mean, I think all the blood comes out the first 2 days, and then in the next 3 days, it's like spotting. I could wear a panty liner, but the first two, I
Hmm.
better not sneeze because it could be a problem. The first two are really heavy,
Got you.
and that's it.
So this one, this one is I won't say it's easy,
And
but
it's just
it's
on the right side, by the way,
got you.
just on one side.
So
Sorry.
the very first thing I would do would be to rule out whether or not this is a gynecological source, right? So when things are not as they seem, it's either one of two things if as it pertains to gynecology. Either A, it's like a structural cause, like a fibroid, polyp, those types of things,
Hmm.
right? Or B, it's hormonal, right? One or the other. So before we start talking about surgical options, I would say let's rule out whether this is a hormonal source, right? So I will put you on a very short term of suppressants. Now it's not I wouldn't do a birth control pill. I would do one of the medications that are for fibroids, like Myfembree, Orion. Those medications shown that help with bleeding, and they should help with pain um, in the temporary. So putting you on like a 2 or 3 month stint of that just to see if things are improved. If they are, we have an answer. If they are not, then we have to take it a step further. And
She did
from
do
there,
a hormone panel also,
that
my
that
G.
won't that
Okay.
won't do it.
Okay. Just
I
note
could tell
that.
you right now your hormone panel is off because your ovaries are starting to decline.
Okay.
It just is what it is. That's I already know that's going to be, but that should not be causing you to have pain.
Okay.
So with that being said, we need to see if this is a hormonal source to your issue. Um, probably from what you're telling me, I would say probably so because the way that it's cyclically bothering you.
Yeah.
There's a certain point in which it gets way better, and then there's a certain point where it's not. So,
It's out of
um,
my. Okay.
So, and somebody said my fimbrial almost caused me to bleed out. Everybody's different. Like things are used differently for different things. It might not have been my fimbrial, but other things. But not back to what I was saying. I would start hormonally first. Then from there, if there's significant benefit, then we have our answer. We talk about the medications that we can kind of put you on for to help. If not, then we start doing the diagnostic things as far as is there anything in your cavity, even though the ultrasound doesn't say anything. Something as simple as a polyp can make you have problems like that. So I would do a hysteroscopy and look into the cavity of your uterus to see if there's, anything in there that could be causing problems. And then I would do a diagnostic laparoscopy, meaning small camera, go in your belly button, taking a look. Let me look at what's on that right side. Look at your ovaries, look at your fallopian tubes, look at your uterus, and see if I can see something that's obvious that could be causing your pain. So that would be my stepwise approach to what you're telling me.
Okay. Okay.
Cool.
Wonderful.
Awesome.
Okay. And what were the two procedures?
So
The
so so diagnostic hysteroscopy. So anytime, and this is just talking to everybody out there, just educational wise. So anytime you guys hear scopy or any scopy, SCOPY, that means camera.
okay.
So endoscopy, colonoscopy,
Mm,
uh, hysteroscopy, like anytime you hear scopy, it's SCOPY. That
it,
means I'm literally putting a camera into whatever it is I'm trying to look at, whether I'm putting a camera into your into your abdomen, a camera through your endoscopy, down your mouth, through
through.
your
Okay.
esophagus, looking at your stomach, colonoscopy, going the other way, looking at your bowel the other way, putting the camera in there, looking at what, like anytime you hear scopy, it's whatever that word is from the beginning and a camera going into that. So hysteroscopy, hysterus is uterus.
Okay.
Anytime you hear hysterus, hysterectomy,
Mm,
hysteroscopy, hysterotomy, all of those things, it just means uterus and whatever you're trying to do. So hysteroscopy would be a scope in your uterus, putting a camera in your uterus and taking a look in to see. And then I would do what's called a laparoscopy, which is the camera going into your belly. So looking at your uterus from the inside, right? Inside through your vagina and seeing what's in the house in the inside lining, and then take going to your abdomen and looking to see the outside part of your uterus from the
mm,
inside,
mm,
and then see if I find something there that could be causing you to have pain. The other thing too is if it's a structural cause, I should be able to reproduce it. Meaning,
mm.
you say you're having a problem on your right side or whatever, I should be able to digitally examine you and press on there and you say, that hurts when you do that. So that would also lead me to believe that there's a structural cause to whatever it is you're talking about as opposed to a hormonal cause. So
Okay.
it's just stepwise breaking things down and just compartmentalizing them to see where you're having your problem at and then start to treat and give you treatment options and going with it.
Okay.
Cool?
That's helpful because taking more pain
No,
pills
that's
is
not
not
that's not the
a
answer.
solution.
That's not the answer.
So I mean, 6 months of prescribed pain. I said, okay, no, thank you.
Right.
I won't be taking
No,
these. So okay,
disagree with that.
I just
Cool.
have my breathing. Thank you very much. This is
You're very
helpful.
welcome. Awesome.
Thank you for
Awesome.
joining
Thank you for tuning in.
and welcome for
That
coming
was
up.
awesome.
Yes, thank you.
All right.
All
I
right.
won't touch anything.
You good.
What do I need to do?
I
Oh,
got you.
he got it.
All right. All right. So let's answer a few questions because I saw a couple of good and then the people that are trying to get on, we'll go to them. The one that I definitely saw that I wanted to answer was where'd it go? She had asked something about uh all right, so that was the first question. She said OBGYN says fibroid is in the lining in the middle of the uterus. If I remove it, I could become infertile. Uh so just real quick, look at it like this. I came up with this analogy when I was talking to a patient the other day. Look at locations of fibroids like your house, right? Your uterus is your house. And so um you got your chimney, your siding, right? Everything on the outside, right? So look at your like the outside part is like your chimney and your lining. I mean your chimney, excuse me, your chimney, the siding of your house, right? Look at the when you hear myometrium or in the muscle of your uterus, look at that like actually in the brick part of your house, or like where termites live in the wood, like you like stuff that you can't see. You can't see it on the outside, and when you come inside, you can't see it. Everything that's like in the foundation or the structure of your house, it's like the muscle of your uterus. And then you had a part where you live at, like your living room, your dining room, your kitchen. That's the endometrial lining of your house or your uterus, right? When you have structure, like let's say for instance, a branch falls off of a tree and goes through your roof, through your attic, into your bedroom. That's when you have like what's called a submucosal fibroid, where it's going not just from the outside, not in the middle, but it's actually going into the house or into the inside lining of your uterus. The inside lining of your uterus, your house where you live at, your, synonymous with your living room, your dining room, your bedroom, that's where babies implant. That's where you're bleeding from, right? So when you have things like if somebody throws a brick through your window, or if you have a branch from the tree that falls through your house and it actually comes to where you live at, that's where you have problems. Now rain can get in your house, snow can get in your house, the elements can get in your house. You don't want that. So when a doctor tells you like, oh yeah, if you have a fibroid and you remove it out of the and it's in your house or in the cavity of your uterus, that it'll leave you infertile. I would agree if they don't know what the hell they're doing, right? So that's why you have levels to everything is levels to surgery as well too. If you have a surgeon that doesn't know what the hell they're doing, doesn't know how to appropriate anatomy, they can remove your fibroids and just throw things back together again. Now you got, chimney particles in your house. You got, still tree branches and stuff in your house. Yeah, baby's not going to implant in there because it wasn't repaired appropriately. But for women that have submucosal fibroids or things that should not be inside their house where they live at, that's there, you can remove those things very safely and repair everything normally if you have somebody that knows what the hell they're doing and is very conscientious about preserving your fertility and preserving where you live at in your house. So um, don't let someone tell you that you can't remove fibroids or remove trees that fell in your house or bricks that came in your house. You most certainly can. You just have to have a provider that knows what the hell they're doing. It's just levels to it. That's all. Um, what? Let me answer one more question, and then we'll kick back to the lives.
Okay, do you want me to
Um,
read it to you, or you
yeah,
got
no,
it?
yeah, you read it. Go ahead. You can see the bubble. I'm sure. I'm doing all the damn jobs. My bad,
Man,
Carla.
you
I'm tripping. I'm on the road. I didn't take your job. Let me shut my mouth. I get that going. You got to shut me up sometime.
I just was saying,
Yeah,
I didn't know.
no, you see
We
the
could have
bubble, so my
2024
bad, my
could be a
bad.
new
Nah, my
format.
bad. Nah,
Could be a
I'm
new
chilling now.
format.
I'm chilling. Hell no, no. Go ahead. Do what you do, baby.
All right. Um, all right. Yes, we save the lives, so I can answer that question. Do you save these lives? Yes, we do. He saves them to his page, and I'll also upload them to YouTube. So if you have somebody that needs the information that actually doesn't have social media, they can see them on there as well. Okay.
If somebody says you may as well get a hysterectomy for any woman, if you don't want a hysterectomy, you don't have to get a hysterectomy. Right above you, uh, Amelia Presenti, like is one of my patients is right above you. That she's documented everything. She's shown you like she had probably one of the actually to date probably one of my worst fibroid cases just from sheer size volume, and I preserved her uterus, 17 and a half pounds with a preserved uterus that she graciously allowed me to post it and to show the entire journey of how to preserve a uterus with advanced fibroid disease. So it can always be done. So if a provider or a surgeon tells you that you cannot preserve your uterus and you want to, you get up, you walk out of their office and you find somebody that can, and they will do that. Trust me, it can all it I have not just had to take someone's uterus just because they have fibroids. Now, if it's a cancer or something else, those are unfortunate incidences that we can't control. But just because you have fibroids does not mean you have to have a hysterectomy. That is highly false.
All right. So this
Well,
question,
Yeah,
I'm sorry.
ask one, answer one more, and then we'll kick back over to the lives because there's people trying to
Okay.
get on the live. So
I wanted to get the doctor's updated opinion on the assessive procedure, like who is or who is not a good candidate for it.
awesome question. So for Accessa is, I'm gonna say the long term first, and then I'll break it down as always. So Accessa is a laparoscopic radio frequency ablation of fibroids. That's a very, long, just difficult term, meaning that laparoscopy or laparoscopic procedure, small incisions, camera goes into your belly. Radio frequency is just a term of heat energy that's used to treat the fibroids. Ablation is just the term of what it's doing to the fibroids. And what it's doing is it's changing the volume or the size of the fibroid, making it softer. Not so much shrinking it, but it does shrink it some, but it changes the volume. So for it's designed to treat um, bulk symptoms. Bulk symptoms mean pain with sex, pain when you have your menstrual cycles, frequency of urination if you have fibroids, um, some infertility. Um, it's notice I did not say necessarily say bleeding because bleeding is something that is not always controlled with or not always caused by fibroids. So if you don't have fibroids that's significantly pushing into the cavity of your uterus or into the house or the structure of where you live at, it's not always causing you to have heavy bleeding. The misconception or the problem that we have is that doctors always say, like, oh, you got fibroids, you come to them, you got bleeding, do ultrasound, you got fibroids. Oh, if I do something to your fibroids, I'm gonna make your bleeding better. This is false. It does not always work like that. Is it true that fibroids can contribute to bleeding? Absolutely, they can. But it's also true that you could have abnormal uterine bleeding and have it has nothing to do with your fibroids. So you have to really be you have to assess uh, appropriately what treating the fibroids is going to do versus what it's not going to do. People that are candidates for Accessa are women that have not advanced fibroid disease, so it's not designed for women that have fibroids that are greater than 10 centimeters, which is like that baby's head. You can treat women that have greater than 10 centimeters, but it's really not designed for that. And also women that have bulk symptoms like I were talking about. Um, so those are candidates for it. A mistake is like, oh yeah, my belly's protruding, I got these big fibroids, excess is going to make things way better for me and my belly can be flat. No, it will not. I will be the first person to tell you and to manage your expectations about what Excessa will do and what it won't. It's very good for the right patients, but depending on what your goals are, what you want, it has everything to do if you're a candidate for it. All
Excellent. All right.
right.
So you want to go to a
Yeah,
live person?
let's see what we got on the live deal. Okay. I think this Usually Allen was first. So let me try her.
Sorry, quick one. I didn't know I was next. Good
Good
evening.
Good
evening.
evening.
Thank
Welcome.
Welcome.
you. So I have a couple of questions, but I'll start with I heard you explain is it essential? I don't know if I pronounced it right.
Excess.
Um, yes, and you mentioned ablation. Is it the same as a UFE?
It is definitely not the same as a UFE, right?
Oh,
So a uterine. So just terminology, and I'm just saying this not only for you but for everybody in here. So let me break it down. So uterine fibroid embolization, right? Embolization, to embolize means basically to cut off.
oh,
So embolization means cut off the blood supply. So UFE, UAE, or uterine fibroid embolization, uterine artery embolization are the same thing. They're synonymous. It just means basically cutting off the blood supply to the fibroids. Excessa is laparoscopic radiofrequency ablation. So it's two words that sound very much the same, where it's embolization
mm-hmm.
and
Like,
ablation.
oh,
So embolization and ablation, two totally different things. So ablation is actually impacting the tissue that you're treating, right? So it's actually going to the tissue and treating the tissue. Embolization is cutting the blood supply off to the tissue. Huge difference. I am not a proponent of UFEs, UAEs. I can't stand them. I do offer them as options because I don't feel that any provider should cut off options to patients, but I definitely tell you how I feel about them. I just don't agree with them. I would not tell my mama, my sister, cousin, anybody to get them because I just don't think that they work very well for a majority of patients.
oh,
But that's the two differences. That's the difference between the two.
okay. Because actually, I guess maybe I got the wrong advice because I had fibroids and I actually underwent 2 UFEs.
Hmm.
And so far, yes, the bleeding has reduced, but the pain is still there.
Hmm.
And the other time I was at the gynecologist, he asked me to go for an MRI, which I did, and they said, "Oh, there are still fibroids there." And if I wanted to do another UFE, and I'm like, "No, I don't want to do
Well,
it."
that's one of the misconceptions about UFE or even Excessa with an ablation is that it does not get rid of the fibroids. You're still going to have fibroids. It just changes the composition of the fibroids, but they're still going to be there.
Wow.
So the only thing that's actually going to remove the fibroids and preserve your uterus is a myomectomy, which is actually removing the fibroids from your uterus. But a UAE, UFE, even Excessa with an ablation of fibroids are still going to have the fibroids there, just in a different composition, if you will.
Okay,
Okay.
so but if you were to advise someone that is trying to conceive, would you advise that the person first goes like me, maybe go take care of the fibroids before trying to conceive?
Not necessarily.
Okay.
Is it true that fibroids can cause infertility and cause problems? Yes, but it's also true that women with fibroids have babies every single day. So it really just depends on the size and the location of your fibroids. If those fibroids are actually pushing into the cavity of your uterus, or if they are very advanced, meaning greater than 10 centimeters, then I would agree that they definitely need to be managed. But if you have small fibroids, that on the external portion of your uterus, or for everybody to heard the analogy, like the chimney
Mhm.
or the
I
siding,
did. I heard
right?
that
If
was
you
pretty
if
much
you
it.
if you have fibroids that are like that, then
Mhm.
no, you can go ahead and get pregnant. They're not causing infertility.
Oh,
Now mind you, this is also a misconception that happens, right?
yes.
That oh, doctor, I'm not getting pregnant. Do an ultrasound and you have fibroids. Oh, it's the fibroids that are causing you to not get pregnant. That's not true. You need to have somebody with the understanding of what's happening because just because you're not getting pregnant does not necessarily mean it's your fibroids. If the fibroids are, like I'm saying, overly large and pushing into the cavity, then
Yeah.
yes, they can be causing for infertility. But two things can be true at the same time. You can have fibroids, and you can also have a man with a low semen, with a low sperm count. You can have fibroids, and you can also have blocked tubes. You can
True.
have fibroids, you can have endometrial polyps. You can have fibroids, and you can have a lot of different, or infertility, and you can have all of those things I meant to say. You can have infertility, and you can have all of those things in addition to fibroids. But you have to see step by
Which
step. Pregnancy is one of those things that it's a very delicate process. You can have everything working at the same time. Your man has the right has perfect sperm. You have a uterus with no fibroids. You have tubes that are open. You have great quality eggs, and you still only have 20% chance for the month to get pregnant,
wow.
right? Right.
Okay.
So it's like if it's a lot of things that go into pregnancy, and don't you have to go to someone that knows what they're talking about
Like
and knows like what's
a
happening.
fertility expert, like endocrinologist.
You don't even have to go there sometime. Like, if you have a thorough OBGYN that can tell you, like, this is the problem and I can fix
Yeah.
this, or check all of those parameters and all of those things and say, hey, this is something where you need to go to a fertility specialist. A lot of the most common things we can fix on our own.
Hmm.
But once it gets past where like all of the surgical things are taken care of and everything else is normal, then yes, fertility specialists would be I have a fertility doctor. If you, her name is Erica Loudon, Dr. Erica Loudon. She's awesome. She has an IG page. It's like growing
Oh,
crazy. She
okay.
has
I'll
100,000
chat you
followers.
up then.
Yeah, yeah. It's just anybody that's out there. Her name is Erica Loudon, Louden. Like her page is awesome. And I send all of my patients with fertility issues to her. She's
Oh,
super dope.
okay. Then last question. I heard you talk about base and acidic. So do you have an idea what actually happens when sometimes maybe after making out and the sperm is like pepperish?
The
Have you had?
sperm is pepperish.
Yeah, like you feel
Hey,
like
hold
you.
on, go back. Hey, wait a minute. You said after making out. I love this. y'all, hey, y'all missed that shit.
No, I heard
I'm immature.
I,
I'm immature. Yo,
I heard it.
you said making out. I love it.
No,
I
I
love it.
just finally, because sometimes it's like like pepper in there, so you have to like pour like cold water or something. I'm like, what?
Say it's hot.
Mhm.
It gets hot in there.
Yeah, so I'm like, is there an explanation? I tried to read up
Yeah.
and
Yeah.
they're
Oh,
like,
okay.
oh yeah, sometimes.
I just, so you want to know what it is? All right. Let me explain. Let me explain this to you.
Okay.
So, all right. So what's happening is like if you have um you could be having rougher sex or you can be having like longer or more extensive sex where you're causing friction, where it's causing like little micro abrasions uh around the introitus or the front part of your vagina, or even causing like maybe some slight or small abrasions or irritations in your vagina. And then so then the ejaculate can cause some irritations because you have those small
Yeah.
abrasions on the vagina. So that's
So,
what it's happening. It's not the
so
sperm.
aberrations, do they happen even when you use like a jelly?
It can. It just depends. It just depends on how hard in the paint y'all going. If y'all going,
No. So
if it's
because
one of
I
them,
saw
if
something
it's one of
like
them nights.
I saw something like maybe the person is allergic to sperm, and I'm like, who is allergic to sperm though?
I mean, allergies are relative though, right? So, it can cause you to have itching. That can be considered an allergy.
Mm-hmm.
It can cause you to have irritation. That could be considered an allergy. So allergies are relative, just depending on
Yeah.
the person. So when someone says they're allergic to sperm, just note that, there's varying types of what people consider allergies. I personally have never seen what's called an anaphylactic allergy to sperm, meaning that ejaculation of sperm causes your throat to swell up and you're about to die. I've
Oh no,
never seen that.
no, not
So
throat.
those
I
so
mean,
right, that's
Why
true
throat
allergies. Like
though?
when no,
no,
I'm
no,
saying
no, not
no, but I'm
that
saying
one.
when you're no. Listen, I don't mean just to the throat. I'm saying
Mm-hmm.
I see ya. So y'all being immature now. Y'all being immature. So I
We
mean
followed you.
like what I mean
Mm-hmm.
is that whether you eat something or not,
Mm-hmm.
grown people,
Mm-hmm.
if you have a true allergy to it,
Yes.
you could put it on your toe and it can
Yeah,
cause your throat to swell,
yeah, I
right?
know
So
what you.
that's what a true allergy is.
Oh, okay, okay.
Your body, y'all sick. Y'all real. Look at these comments. Y'all sick. It's cool though. So
Oh, but
so
like
yeah,
you said, did we hear her? Did we
yeah.
hear you?
So an anaphylactic allergy means your
Mm-hmm.
body is performing I mean, is mounting a response to whatever that irritant is that will cause like swelling of everything. I have not seen that with sperm, but it can definitely cause irritation, right, of varying levels. I have had women that have come to me as like anytime he ejaculates inside of me, it's like I'm on fire. And
Mm-hmm.
I tell them with that, a couple different things. Either A, tell them to stop ejaculating inside of you, or B, just kind of figure out like, what's happening. It could be other things. It could be like the things that are on his penis. Maybe it's not washed off very well, or maybe you're using perfumes down there, or things that are being introduced into the vagina during sex. It could be a lot of different things that are not just the actual sperm causing it to do that.
Okay, okay,
All right.
okay. So let me give space for other people to be able to ask. I'll go ahead
You
and
did.
schedule a consultation.
Good job. We appreciate it.
Well,
Appreciate it.
thanks for
All right.
Thank
joining,
you.
though. You was awesome.
Thank you.
Thank
All
you.
right,
Awesome.
guys.
All
Have a
right.
good
All
one.
right.
Thank you.
All right.
What man? What's wrong? What's wrong with y'all, man? What's wrong with y'all, man?
You started it.
You want
Okay.
you want to do more questions, or you want to get another live in, or what? Let me get another
Oh,
person
it's
on.
up to you. What do you want to do next? I can go to another
Uh,
question, or
we can get well. Go get another few questions in, and then we'll do like two more questions, and then we'll go back to a live.
okay. This one is for me. Well, it could be for you and me. How does a hysterectomy affect a woman's ability to experience orgasms, or how does orgasms change? So in my personal experience, it had no impact on the orgasm feeling, changing, happening different, the amount of lubrication. It was not different for my personal experience, but you have way more patients than what I dealt with. So what do your patients usually tell you?
Nothing. I haven't heard one. Well, no, I take that back. I've heard a few patients say that the orgasm is slightly different. Like they orgasm and maybe just a different sensation, but they don't have a problem with orgasms. So but I haven't heard a person say I was having great orgasms up until sex, and then up until surgery, and then after surgery, I can't orgasm. I cannot recall a person um, presenting with that issue. Um, Quick question. Somebody said, what case would you be considered too severe for surgery? What fibroid case would you could be considered too severe for surgery? There isn't one. There is not one. I have not seen one that I will say, oh, I can't operate on it. And I proudly stand on that. I will take any fibroid case, no matter how large it is, no matter how many people said that she has to have a hysterectomy or has to have a vertical incision. I am committed to doing every single fibroid case in of existence, and every one of them done with a small, low transverse incision. So I love saying that. But go ahead.
Okay. So a lot of people who ask in because the numbers are climbing. So we get new
That's
people, same
that's dope.
people, different people. If you're joining tonight and you want to ask a question, you can request to join the live and ask your question in person. You can also drop the question in the question mark that has the bubble around it, because we do screenshot. So if we don't get to it tonight, because we do be on a time constraint, then we actually will roll it over, because I actually have a running list. I haven't even asked none of those
Damn.
questions. But and man, my list was blowing up because it took us a little bit longer
We
than
got
usual.
we got to do this. We got to do this in like another week or two. Like we got to
Yeah,
catch up.
my schedule been a little bit better. It
Yeah.
just was a little hectic at the end of the year.
Well, I quit a job, so I got more time. So
Oh, okay.
yeah, so I'm a little liberated right now.
Nice.
Yeah.
Okay. Well then, yeah. All right. So if you want to ask a question, please drop it in that question box. So we're gonna take the next request to join, and then we're gonna go back and forth. And then we, like I said, we won't wait as long next time.
Maybe she didn't accept it. All right. If you don't accept it, I'm gonna go to the next person. Maybe IG is not letting people
Yeah,
be
IG
great again.
be tripping. Even though it
Yeah,
rolled out
I'm trying to let y'all in.
it rolled out some
There we
new
go. There we go.
features.
There goes
There we
somebody.
go.
Hello.
Welcome.
How are you?
Hello.
How are you?
Good.
Good, and you?
How are you?
I'm good. Good. This is awesome.
Dope.
Thank you.
Yeah, thank you for answering my question earlier. Yeah, so that was kind that's like my situation. But I would love if you could answer a few more follow-up questions, if that's okay.
Sure.
Yep. So I was diagnosed back in October of 2022.
Mm-hmm.
And basically like I have like a few fibroids, but I have one that's like the big one, and it's like in the lining in the center
Mm-hmm.
that the OBG was mentioning.
Mm-hmm.
That one's about seven
Okay.
centimeters. And um yeah, so like it's caused like a lot of like very, very, very heavy bleeding and clotting. Like I became pretty severely anemic, and like at one point I had to go to the hospital. My hemoglobin dropped all the way to like a 4.
Ouch. Wow.
And so they put me on the mini pill, like the progesterone pill. And at first for like a few months it was
Mm-hmm.
helping. It put aside like any kind of
Mm-hmm.
bleeding. But then I went to like work out and like did a little bit more, rigorously than I usually do, and then it started to all come out again. And it's kind of been like that ever since. Like I've had like spotting and then like a period of like pretty heavy bleeding.
Mm-hmm.
And I recently did like a series of iron infusions and was able to get my hemoglobin up to like 12.6.
Okay.
But then like in like 2 to 3 days, just all came out again and like dropped 4 points in like 2 days. So I almost like fainted and
Mm-hmm.
had to go to the ER again. And they said, well, because it's not below an 8, that I can't get like a transfusion or
Mm-hmm.
anything. So I guess, like I've actually, like the doctors have been saying, like you should look into getting a myomectomy, hysterectomy. I even saw an oncologist, and the oncologist was actually the one to tell me like not to do the surgery because he
To do
was like,
what? To do what surgery?
like a myomectomy.
Why?
He said like I'm too young. He said to wait until like I'm ready to conceive and to just stay on birth control until then. But the progesterone pill, it started to not work for me.
Yeah.
So
Yeah.
like yeah, I was just wondering like what your thoughts were about that. And like I've been trying to heal this thing naturally, and I made the mistake of trying to do it by myself for like a few months, almost a year, and that's what landed me in the hospital. But now I'm like working with a naturopath, and yeah, I was curious to see like what your thoughts on are about that, and like if you think any diet changes might help or anything. I'm trying to shrink it naturally because my concern with getting the myomectomy is like if it grows back or something.
Understood. And how old are you?
I'm 33
Okay.
and I want
So,
a family at some
got you.
point.
All right. So, it's a lot to unpack there. Well, let me try to unpack it for you. So, first and foremost, my philosophy on just fibroid surgery in of itself has changed, and I talk about this all the time. I stopped doing laparoscopic myomectomies about 5 years ago because there's absolutely no way to get all fibroid tissue without being able to feel or touch the tissue, right? Or touch your
Mm,
uterus, right? And so my own personal experience, which is vast when it comes to fibroids, is that, and why I have the philosophy is that if you get all of the fibroid tissue, if you get every single particle of fibroid out, the chances of fibroid recurrence is low, and the chance of
mm,
fibroid recurrence and it actually being a problem for you is even
mhm.
lower, right? So I have to date, I have not had a patient that I've done extensive fibroid surgery that has come back to me with fibroid disease that I've had to reoperate on, right? Because
Okay.
I'm focused on getting every bit of fight. Like I'll sit up there for an hour, hour and a half, 2 hours, just filling your uterus, making sure that I get every single bit. Like
Yeah.
literally, you can have people think that, something like this will be
Hmm.
it's not causing you to have problems, not causing you to have issues, and they leave this. This is left
Right.
all the time. When you do
Right.
laparoscopic surgery, this is left, and this is where the problem is at. So anybody telling you like, oh, it's gonna come back or whatever, they don't
Yeah.
go get this. My focus, the big ones are easy. I want this, and I want the ones that are half this size and a quarter of this size. So if you do that,
Right.
you most certainly have a very, very, very good chance of not having it recur. The other things that you talked about are, we talk about, like, I do a the thing with a naturalist, a whole holistic medicine person, that
Hmm.
I believe in, for a lot of different things. Not with eradicating fibroids though. When you have
Really?
fibroid, no, when you have fibroids that are extensive, like you have a fibroid that's literally, you have a 7 centimeters. So 7 centimeters is about that big. That's 7 centimeters. You have a fibroid
Yeah.
that is literally the size of your uterus, that's
Wow.
in your uterus. And it's not only in your uterus, it's pushing into the cavity of your uterus, which you're trying to have children from, right? You
Yeah.
you do have youth on your side, but you don't have a lot of youth on your side. You don't have 10, 15 years to be able to present a house that is conducive to bear a child with,
Hmm.
right? At this juncture, I'm not saying that you can't get pregnant. I am saying that, if listening to what you're telling me, that if it's truly that case, that you're going
Hmm.
to have difficulty getting pregnant, and if you do get pregnant, you're going to have difficulty keeping that pregnancy. Now, if that 7 centimeter fibroid was on the periphery of your uterus, like the chimney or the siding,
Yeah.
not a conversation. It's not a problem. But
Right.
because that fibroid is pushing into the cavity of your uterus, you're going to have problems, right? And so
Okay.
I would strongly recommend that you address that sooner rather than later. Because if
Okay.
you waste your years, or at the bare minimum, think about preserving your eggs,
Right.
right? Or
Yeah.
freezing your eggs, if you're
Oh.
going to go the natural homeopathic, like if you're going to do that and try to give yourself the opportunity. I'm not completely discouraging that,
Mhm.
but don't look up and you're 36, 37, and now your egg quality is a lot lower. And now you dealt with
Right.
fibroids, but now you don't have the quality that you need to have. Right. Not to say that
Yeah.
you will. I'm just throwing scenarios out there. It's just having an insurance policy. You wouldn't drive a car off the showroom floor without insurance. Right.
Right.
You
Yeah.
you would always have insurance. You may not never need it. You may not never need to use those eggs. But if you get into an accident after you pull off the showroom floor, you damn sure want to be able to call State Farm and say, "Hey, fix this." Right?
Yeah.
So you want to have eggs that you could be able to utilize. So like, again, I watched the documentary, and this is off the topic. I just watched a documentary on Netflix uh last week, that has changed my life and changed my perspective. I am now a new vegan. Like, I am now, I'm
Oh,
not
that
dealing
was a
dealing with
good. I
meat and
know which one
anything.
you're talking about.
Like, so it's called, You Are What You Eat.
Oh,
And
Mm-hmm.
so
okay.
I'm changing. I can't eat meat anymore. I mean, I'm not saying I'm never going to eat meat again, but it's going to be very rare.
Yeah, it didn't
I'm not.
work that much on me, but
I'm definitely not eating chicken.
Wow.
I'm definitely not eating salmon. Like, the only thing that I'm not giving up is seafood. I will do that every now
salmon
and
is
then. But I
seafood.
say, huh? What'd you say?
Salmon is
No,
seafood.
salmon is salmon. Salmon
Wild
is
caught.
fish. Fish
It's
versus, listen, if it has a shell on its back, it's not in a farm. But anyway,
oh, it,
I digress.
okay.
I digress. But back to what I'm saying is that when you talk um about living healthier lives, and when you talk about herbal medicine and those things are great for our overall health, right? It's our
Mhm.
overall health that we're talking about. We're talking about your longevity of life, your hypertension, diabetes, like those things are good. I wholeheartedly endorse doing those things,
Yes.
for your health. The problem that I have with it is when someone says, "Hey, if you take this, that
Hmm.
it's going to shrink or eradicate this." That's the
Yeah.
problem, because
And
there are
that
no
hasn't been
studies on that.
your experience with the.
Absolutely not.
Oh,
Absolutely not, because there's no proof in it. Now, when you talk about, and like which Coach Jesse talks about, and
right. The
is about,
fasting and everything.
right, it's about, like, prevention, or like after you have your myomectomy, like preventing these growths and inflammation from coming back. I wholeheartedly agree with that. But if you got
Okay.
a you got a 7 centimeter fibroid that's pushing into the cavity, there's nothing that you're gonna be able to take that's going to change that, other than removing that from that cavity and repairing your cavity.
Right.
Right.
Okay.
So that's just my advice. But again, you could do a lot of different things, to do it, but be very cognizant about your
Mm,
timeline and what you're trying to do. You have a very serious condition as it pertains to your fertility, but it also as it pertains to your health. Like
right.
the worst thing that can happen is you get severely anemic and you're driving and you lose consciousness while you faint
Yeah.
while you're driving, or you're walking down the street and you faint and hit your head on something or whatever. That's how anemia can
Yes.
kill you,
Yeah.
right? So, and your
That's true.
body is not being perfused. You're having a lack of oxygen to your brain. You're having a lack of oxygen to your tissues. So this is
Mhm.
very serious what you're going through. You don't have a lot of room
Right.
and time to not address this. Um, so
Okay.
so just be cognizant of like things that are not proven. You need something that's immediate, and especially if you're talking about your fertility and trying to really,
Yes.
get yourself and your body ready for pregnancy, you need to be, I would say, more direct and more intentional about that.
Okay. No, I really appreciate that because I was like thinking about like taking like a year to try to heal it naturally, but after, hearing the conversation, I'm kind of thinking a more urgent approach is
Yeah.
needed. So how long does it usually take to heal from like the myomectomy?
So if
Like
you get a
from yours?
myomectomy from heal or to get pregnant,
Oh, I guess
two to-
both. I don't know.
two totally different things. So
Yeah, I guess
you need
heal too because like work, like if I need to go back to work or
very
something.
good question. So I'm different. I think about it differently, right? So I
Hmm.
don't like after surgery, like I am very liberal about getting people back to work and to their normal lives.
Yes.
I don't believe that you should be sitting in a bed just saying just because I had surgery I can't do anything. So
Okay.
for my myomectomy patients typically are back to work in about 2 weeks. Now
Okay. Yeah.
that's minus the manual labor, the CNAs, the mill workers, those that you need
Um,
4 to 6 weeks if you're doing manual labor and you're lifting, you're doing things. But if you're sitting at a desk, you're doing something that's non-strenuous, you could get back to work within about 2 weeks. As far
okay.
as like completely healed, like the things that you can't do is like you can't lift super heavy.
Mm-hmm.
No ab work. That's between 4 to 6 weeks. And
Okay.
then as far as when you can get pregnant, 6 months, no less than 6 months
Okay.
minimum.
All right. No need to worry about that. So,
All
all right.
right.
Unfortunately.
All right.
Okay.
It's just about planning. It's about planning. Like,
Yes.
yeah, you want to preserve your fertility. You want to
Mm,
get things in order, but more importantly, your health.
yes.
Like, let's put baby aside. Let's talk about you being severely anemic and going to the hospital and having to do iron infusions and things like that. And
Yeah.
in response to this, and people, talk about like, I'm taking iron, I'm doing things like to build up my blood. Look at it like this. Another analogy.
Mhm.
I'm all analogies this year, right? So think of it like a tub, like a bathtub, right? So
Mhm.
you have a bathtub. You put a stopper in the bathtub. You fill the water, you fill the tub up all the way with water. Now,
Mhm.
if I open up that stopper on the tub, even if I pour water in, if that stopper is allowing water to leave quicker
Yeah.
than the water that's coming in, you could take iron, you could take iron infusions, you could do whatever the hell you
Yeah.
wanted. You can even do blood transfusions. If you're putting it in and it's leaving out of your body faster than you can put it in, then
Right.
that the level is going to decrease. You're going to be anemic no matter what. So you have to put
Yeah.
a stopper on a tub. So if the stopper means removing fibroids, getting the hormone suppressants, those things, you have to be able to stop that blood from leaving out of your body.
So how does that work? Like, because I was surprised, honestly, by the amount of blood that was coming out, like for those 2 days. Like, is it all just stored in the uterus at once, or does it keep getting created and shed and created and shed? How does that work?
No, so what's happening is that, and this is getting kind of technical. So if you guys like, oh, you getting too technical, break that down for me. I will. All
I
right.
like to know how things
So
work. So,
absolutely. Yeah, this is an excellent question.
mm-hmm.
So just let me go back to my analogy of like the house, right? You heard like I was saying the house. So like the inside where you live at, your living room, your kitchen or what have you. Just
Mm-hmm.
imagine that now, like in your case where the fibroid is at, you have a tree that's pushing in, fell through your roof and now in the inside. Well,
Mm-hmm.
it's messed with the paint, it's messed with everything on the inside, but in
Uh-huh.
relationship to your uterus, there are small blood vessels that are in the lining called radial arteries, and those arteries are closed off when you have a lining that's there, right?
Okay.
But when you have fibroids or polyps or things that are pushing in, those arteries can be open, and they can be open
Oh,
extensively until the lining is built back up. When you have a structure this really changing the dynamic of the
yes.
lining of the uterus, it causes extensive bleeding because those arteries are now open. You don't have tissue growth over those arteries, and you're just profusely bleeding because
Wow.
the structure of it is now impacted because the fibroid or the branch is in there when it should not be in there. So that's why you're bleeding extensively
It's
like
like
that.
open blood vessels, basically.
Correct.
Kind of.
Exactly.
Huh. Okay. And then I guess my final question, and do you know anybody like in the Fort Lauderdale area that you trust? Um,
I
or that's where I am now, but if not, then I'll try to find a way to see you, I guess.
got you.
Yeah.
I did meet a doctor in Jacksonville.
Okay.
Um, he's in Jacksonville, Florida, and I can't 100% vouch for everything, but at least in our conversations that I've had, I like what he was talking about. So I would tentatively say yes, that he would be a person to actually look up. And his name is eluding me. I just caught a brain fart. So if you DM
Okay.
me, I can give
Yeah,
I
I
can
can
give
follow
you
up
his
with you
name.
too.
Sure.
Yeah.
But with
Yeah.
that being said too, I have like patients that fly up from Florida all the time. So
Okay.
that's
Yeah.
absolutely no problem if that's what you need. But he will be the doctor that I would say, hey, you could look at and see, how he would approach your case and talk to. At
Okay.
least, just talking to him, I know he's competent. Which is
That is
what you
like
need.
aligned with what you
Yeah,
practice
with
and everything.
align with what I'm practicing. He's a minimally
Okay.
invasive guy. He does things aligned with what I'm doing. And for what you have,
Yes.
yes. Now when you get extensive, like you have fibroids that are like 20, 30, 40 centimeters, I
Yeah.
can't. It's not many people I could recommend, but for something like you have, I definitely think it can be managed. So just
Everybody's telling
yeah.
me
So
to go to Chicago. Is that where you're located in
yeah,
Chicago?
Yeah,
I'm in
we
Okay.
Chicago. Yeah, I'm in Chicago.
Oh,
But yeah,
don't
just
come this week
D
though, because
yeah,
tomorrow I don't
it's
know.
gonna be crazy. But yeah,
oh, really? Why
it's
tomorrow?
it's
I'm
supposed
just
to
they saying
snow
it's
real
gonna be a
bad.
blizzard, but they
Oh,
said that
okay.
Tuesday too, and
Maybe
well, at
you
least where
should
I
come
was
to
at, it
Fort
was like
Lauderdale instead. Get a like sunny
Boy,
vacation in and help us out
not
down here.
not when DeSantis is still in office. That's a whole nother conversation.
Okay. Yeah. A different kind of climate.
A different type of climate. But yeah, just DM me to remind me, and I'll give you his
Okay.
name. Okay.
Okay.
All right.
I will.
All right.
Thank you so
A
much. I
pleasure.
really
Thank you.
appreciate you
You're
taking
very
my call.
welcome.
Thank
Oh, of
you.
course, absolutely.
Thanks very much,
All right.
guys.
thank
Bye-bye.
you.
All right.
Okay, so the chat people is mad.
What they mad? Why they want their
Yeah,
questions answered?
we do I'm telling y'all, I've
Uh,
screenshot. Y'all not gonna
Damn,
keep
this is the most people that have wanted to jump on live like ever.
exactly.
Um, so like people, it's like a lot of people that want to jump on here. But okay, answer another couple
Okay.
questions.
Um, does myomectomy make sense for a 50-year-old, or is hysterectomy best for a large fundal
Sim,
subserial? Serosal?
simple answer to that. What's your goal, right? Your uterus, and people don't like this answer, but your uterus has one function. Your uterus function is to have children. If you want to have children and you have a viable option to have children, by all means, keep your uterus. If you don't have any problems with your uterus, leave it alone. But if fibroid disease is a problem, or bleeding or anything like that, and you're done having children, then hysterectomy should be on the table. Doing a myomectomy is a more extensive surgery, right? Taking that out and preserving your uterus, repairing your uterus is extensive. It can be done and should be done if there's a purpose for your uterus. If there's no purpose for your uterus and you have this problem, don't do don't do a more extensive surgery, and you don't have, a fruitful means to what you're trying to do. That's my answer to that. Like, this, if you need surgery, ask the first and foremost question is, what's the goal? If the goal is to fix and get rid of fibroids, and you have no interest in pregnancy or having a child, then you at least need to put hysterectomy on the table as an option.
All right. I have had 4 C-sections. Does scar tissue pose any risk to removing fibroids? My gynecologist just told me that I have to have a hysterectomy because there will be nothing left to save of my uterus after removing 6 fibroids. What is the likelihood of that being true?
I disagree. It makes the surgery more difficult. Yeah. So, scar tissue, which you have from multiple surgery, makes surgery more difficult, but it doesn't mean you have to have excuse me, that you have to have a hysterectomy. You can have a myomectomy if you want, but I would say, be very, very honest with yourself as far as if you want another child or not, right? Because it is an extensive surgery to preserve your uterus. So, if you do want another child and it's feasible for you, then yes, by all means, you could preserve your uterus. But it is going to be more extensive. So definitely choose wisely when it comes to your surgeon, because you can get into a lot of trouble. You got adhesions to your bladder, adhesions to your bowel, adhesions to things that you may not know. It could be very bad. It could be not so bad. But if it is very bad, you want somebody that goes in there that knows what the hell they're doing, because it can be not good for you. So, but in direct answer to your question, no, you do not need a hysterectomy just because you've had multiple abdominal surgeries.
Okay. Um, what's your time looking like?
I'm straight. I
Okay.
told you I'm not, man. I didn't freed it up. I'm not on call no more. I'm at the crib now. Just my kids just trying to talk to me. Other than that, I'm good.
Oh, okay. All right. Do you take insurance for virtual visits?
Nope, not sure do not. No, I do not. If I'm going to spend my hour and a half, because I don't put you on a time limit either. Those are on my own personal time, and that's not in office. It is literally time away from my kids, time away from my family, time away from things I need to be doing to talk to you about every fibroid issue, questions, concern, everything you have. And no, I'm not taking insurance. So insurance is a pure ripoff. If it was, if I was not doing this for the love, which I don't do it for money, I do it for the love, because if it was for money, it would not be doing this. Just imagine, like I tell people all the time, like, imagine if you go to your job, whatever your job is, and you just start working, whether that be a hairdresser, whether that be a lawyer, whether that be anything, and all of a sudden it's like, this hour, you ain't gonna get the money you're supposed to make. You're gonna get what we think you're supposed to have, which is like 20% of what your rate is. If you make $30 an hour, somebody just all of a sudden give you $7 for 3 hours just because they feel like it. That's what medicine is, right? So the bill that you see or whatever that they bill you for or whatever, all that stuff, your insurance company doesn't pay a tenth of that. So, if you have a $1,000 consultation, let's just throw it out there, your insurance is gonna pay $150. That's how they twist the arms of hospitals, doctors, and that's why bills are so high, because insurances really mess up the game. So when it comes to me and my time and everything, I don't. Now, as far as in-person visits, surgeries, all of those are billed through insurance. I don't do people like that. I'm really all about trying to help people, so I'm not trying to fleece anybody or just take money. So I definitely am for insurances. But when it comes to the person calling me from, you know, New England, or Sacramento that may or may not need surgery or what have you, and I'm gonna spend an hour and a half or whatever talking about everything they want to talk about, asking questions. No insurance for that. Sorry about that. Sorry, but not sorry. How about that?
Okay. This is a submitted question outside of the box because I got those too.
hmm
So it's lit tonight. And you said there's more people in line to join, right?
Yeah, it's a couple
Okay.
people in
So
line to
I'm gonna
join,
do
so
this one and then we'll go back to another live person.
okay.
Okay. So I watched the previous live about choosing between birth control and getting your tubes tied once you get to a certain age. But what are the side effects of having your tubes tied? I have heard that heavier periods, worse cramps, and vaginal dryness are a result. Is that true? Is there a difference between tying the tubes side effects versus removing the tubes completely side effects?
Excellent question. So the the things that you hear about, how periods change and things after, the tubes being removed, uh, there's really no physiologic basis behind it. But there are reports. Uh, there's some data that's shown that, yeah, some women can have slightly heavier periods after tubal ligation or whatever, but that's not what I see, right? In my, just talking real talk about like patients that I've done tubals and stuff on or whatever, I don't experience that very often. So I would not say that that's not an option if you're really done having children. You look at the side effects of anything, right? There's side effects to medications, and there's a side effects of surgery. I definitely say overall, when you're looking at the global scale of things, the side effects to actually doing permanent sterilization are far less than the side effects of actually taking medication to prevent pregnancy. So as far as removing the tube versus doing, other sterilization techniques, it is not recommended that you remove the tube. Reason why is because there's many ovarian cancers that actually originate in the fallopian tubes, right? They found this, so it makes absolutely no sense to, if you're going to do a tubal interruption or do um, a tubal on, tube, it makes more sense to remove it as opposed to just taking a little piece of it or burning it. So I would highly recommend doing that. But as far as the long-term complications, risk, or whatever to removing a tube or removing tubes, in my personal experience of dealing with thousands of women, do not hear or see many women say that their bleeding or pain is worse because of tubes. And for sure, the last thing that you said, as far as vaginal dryness, that definitely doesn't happen. That has everything to do with ovaries. So unless the doctor compromised the blood supply to the ovaries, you should not have any vaginal dryness or any type of issues as it relates to menopausal type symptoms just from removing the tubes.
Okay. And so just because she asked me personally about my case, Dr. Johnson didn't do my tubal ligation. I didn't meet him till much later in life. And personally, my cramps did change, but I had really, really bad cramps, had kids, and then they went away, had a tubal ligation, they came back. So I can't say that it was worse than what they were before. It's just they came back after I had and I think I had the cut and burn. I didn't have the removal.
hmm
I think. Do you remember?
you probably no, you had tubes.
Yeah.
You had
Yeah. So
tubes.
I
They was
think
they were interrupted.
okay, that's what I thought. I think she just clipped them and burned
Yeah,
or tied them.
which which if you had it before, I would say in 2016, 2017, if you had your tool before then, chances are you had an interruption. You still have your tubes. It's just a piece that's missing out of it, or it's burned or something like that. Um,
Yeah, and that's what I feel like
yeah,
they did a piece and a burn. They did
yeah,
both.
yeah,
But mine was definitely before 2016. It
yeah,
was like 2004
yeah. That's
or 5 or something
most.
like
Oh, you definitely, yeah.
that. Yeah.
You just had a piece.
But like I said, patient wise, the cramps weren't worse. and I definitely didn't deal with vaginal dryness. They just came back, if that makes sense.
Yeah. So you want
Okay.
to put another person on? You want to ask another couple questions?
I got shoot. We got it from all directions.
All
You
right.
put somebody in there.
So put somebody on. All
Mhm.
right. All right. So I'm gonna try to put this lady has been waiting on here again. I tried it before, but let's see again. I think it's just her connection. All right. Let me try somebody else. I, so keep calm and pray. 66. I done tried multiple times, Mama. It's not happening. Um, I don't know. I don't know what it is. Put the next person up. There we go.
Oh, wow,
Look,
look at there.
look at there. Look at God. Won't he do it?
Well,
How you
hello.
Hello, hello.
doing?
Thank you so much for taking the time to really sit and answer all of these questions. I mean, I know
No
as
problem.
a surgeon, you have a busy schedule, so I appreciate that.
No problem.
I have a quick question. So I've had two myomectomies. My last myomectomy, I had 42 fibroids removed, and now they're back.
You said
42.
42? Okay.
And now they're back. And so I met with the surgeon. She placed me on Lupron. So I was on Lupron for about 2 months. I did notice a significant decrease in the size of the fibroids just because they were protruding from my abdomen. So I could see how I felt like they had decreased. However, I had all of the side effects, hot flashes, irritability, night sweats. I was miserable.
Mm-hmm.
So I was only on that for 2 months, decided not to go forward with that surgeon. But my question to you is too, you mentioned earlier if a patient is responding with medication being via hormones or something to that point, then you may approach their case differently. If you do know that it is because due to hormones or whatever, what do you do in that case, or do you still proceed with surgery?
All right. So there's two different things. Is just for me to clarify what I was saying. So, uh, as it pertains to hormones, I'm literally talking about things that hormones impact. So hormones can impact abnormal bleeding. They can cause pain, right? Just from things like adenomyosis, endometriosis, which are totally different things, right? But as it pertains to fibroids, I don't believe that giving hormones for fibroid shrinkage or to treat fibroids makes sense. Now, there are medications that are designed to decrease the bleeding
Mm-hmm.
that fibroids
Mm-hmm.
cause, like Myfembree and um, Orion. Those are just designed for bleeding. But
Mm-hmm.
when it comes to giving medications to shrink fibroids, I totally disagree with it. Couple of different reasons. Number one, putting you on Lupron.
Mm-hmm.
Lupron is a temporary
Mm-hmm.
medication. It's a band-aid, right? In addition to that, it has a significant side effect profile, as you've seen.
Mm-hmm.
The other thing that people don't understand is, and even doctors don't even understand, is that doing fibroid surgery while you're on Lupron is a nightmare. Be,
Oh.
because Lupron is going to make fibroids soft and it's going to make them mushy. And so if I did a myomectomy on you right now, with being on Lupron, it would be a total nightmare. So I don't do like a patient's on Lupron, I take them off of Lupron before we even go back there because it's a
Wow.
mess. So when I see, providers giving patients Lupron for fibroids, my question is, what is your goal with that? If you answer that question, they don't have one. They are really prolonging the inevitable
Mm-hmm.
because they either A, don't want to take you to surgery,
Mm-hmm.
or they just trying to just kind of push you along with it. There's really just no answer. So I don't agree with putting anybody on Lupron unless, I mean, the only time I put patients on Lupron is for endometriosis or like pain. It's for
Okay.
pain. It's not for bleeding. So if you're putting somebody on there for fibroids, it should not be. And going back to your particular case, like I was saying, again, I'm not just knocking any doctor or whatever when I say these things. So everybody take it with a grain of salt. I'm just telling you what my experience with fibroid surgery and why I kind of approach things differently. And I watch people, operate on patients. Even though you have 42, you probably had 82 or
Mhm.
62, right? They got to a point where it was like, oh, it looks good or whatever. But they did not go in there finding ease, right? They did not just extensively just like take your uterus doing
Yeah.
this for an hour to get this. And if you leave these, they come back and they can
Yeah.
be very much bigger. And I think that's the problem that you have.
Uh-huh.
So if you did do another fibroid surgery, I would make sure that every single speck of fibroid is gone, and that would be the catalyst for you not having to worry about this in the future.
So
Um,
would a fibroid not develop on healthy tissue? Does it only reoccur if there was a previous fibroid?
Not to say that I won't say that because fibroids are started from genes. So I would not say that, but I say this. It's just a sheer a component of time. If I get everything and I completely clear your uterus from fibroids, the chances of a regeneration of a fibroid and the time that it's going to take now to become of a significant size, you don't have enough ovarian life left to do that,
Mm-hmm.
right? You'll hit menopause
Mm-hmm.
or closer to menopause, and your ovaries will start to decline
Mm-hmm.
before you get to that point. So I'm not saying I'm like God and I could just take fibroids and you'll never get
Right.
fibroids back. But what I am saying is that if I make sure that I get all of the fibroid tissue, the chances or the opportunity for you to have a regeneration and for that regeneration to get big enough to cause you problems are nil to none.
Okay. And the previous surgeon, he used platelet-rich plasma injections during my procedure that was supposed to
Mhm.
regenerate healthy tissue, so it would minimize the amount of scar tissue.
Mhm.
What are your thoughts on that? You won't really know unless you went inside and actually explored and discovered whatever, but have you utilized PRP? Have you found it to be effective?
I have not, and there's some studies that show it does have an impact, but my focus, um, and I'll say the reason I have not dived into it is because it is also very expensive to do it, right? So when you look at the surgery and the overall thing, just me convincing the powers and be in the administration to actually utilize it, uh, routinely because mind you, if I do it for you, I got to do it for my Medicaid patients, my charity patients, and like it could be a problem. So I'm not against it, but I'm more focused on the technique of surgery,
Okay.
right? When you meticulously dissect and um you dissect tissue planes appropriately and you put tissues back
Mhm.
together very meticulously and appropriately, that more so plays the role of preventing scar tissue in the future as opposed to me putting an agent. You can do a crappy surgery and don't meticulously do things, you could put PRP and stuff all day long. And the
Mhm.
reason why you have scar tissue is not because the PRP didn't work, it's because you didn't meticulously perform surgery like it's
Right.
supposed to.
Okay.
Because adhesions and scar tissue form from healing. It's a natural healing process. But if you don't have open tissue and things are connected back appropriately, like the way they should be, then the chances of them forming very significant scar tissue or extensive adhesions are much lower. So my cases that I explore, like when I see patients from surgeries, whether they have another C-section after myomectomy, or if I have to do a laparoscopic surgery, just like I had a patient just recently that I did like a robotic hysterectomy on, and then I had to go back and I had to remove one of her ovaries. Just looking at the minimal amount of scar tissue she had, it just was a testament from how I put things back together
Mhm.
again. So I have
Mhm.
multiple different patients that a large sample size of seeing how meticulous surgery plays a part in the recurrence of scar tissue and how it plays for your future health.
Okay. Got it. Again, I appreciate you taking that time, and I am a naturopathic doctor.
Awesome.
So,
Awesome.
and I say that to say that I agree with you. I get so frustrated when I see health cert, I don't know, what do you call them, but health quote unquote experts
Hmm.
stating to drink this special drink or do this detox and it'll clear
Yeah.
your fibroids.
Right.
I am a board certified naturopathic doctor. I've been practicing for 10 years. My journey to naturopathic medicine was because I had fibroids. And I still continue to battle them again
Hmm.
because they are genetic. There's a lot of new research showing about the microbiome within
Hmm.
the the uterine cavity, and
Hmm.
how it's similar to the gut microbiome with things like beta glucuronidase,
Hmm.
and using like monoclonal therapy to help reduce that and effects to reducing
Hmm.
fibroids. So there are other things out there, but yeah, just a vegan diet and drinking a simple shake with herbs is not going to cut it.
Agree. We need to
Yeah,
talk. Like I would definitely like to hear some of the things that you've
yeah,
read in your research because it's knowledge is power. Like I don't know everything. I know how to operate and how to deal with fibroids, but
hmm,
just from a holistic standpoint, I'm always
yeah,
open to learning and to see what's out there. That's awesome.
for sure.
And I think just from an educational and a platform wise, like people need to hear from you because there's so
Yeah,
much misinformation about things. You need to hear from somebody that is
right,
specialized in holistic medicine.
right,
What's realistic, what's not realistic. Again, like people say, all you want to do is cut on people. That's not true. I could tell you right now, it's multiple patients that I see every day that I say you don't need surgery. I don't want to operate on you.
wow,
When you need it,
right,
you need it. When you don't, you don't.
right,
And there's a place for everything. And holistic medicine for our overall health,
yeah,
absolutely. Like we need it. Like all these cancers and things or whatever,
yeah,
it's because of what we're eating.
right,
It's because of how we're living our lives. Like, our food is medicine and it should be utilized as such, but it also we have to be realistic about what it's going to do and what it's not going to do.
right,
So, having someone that can, speak on it
yeah,
is
sure,
awesome. So I would love to, get on a platform with you and have some
for sure,
conversations too.
for sure, absolutely. Again, thank
Cool.
you for your time.
No,
Thank
thank
you.
you
Awesome.
Have
All
for
right.
joining.
Awesome.
have a good one.
Awesome.
All right.
All right, too. All right. Want to do another one real quick?
Yep.
All right.
What's your oh, you said
No.
you're not on call,
Okay. I
but
think, hold on.
How do I?
Instagram, what's the current time limit?
I believe it's 2 hours.
Okay,
Like
but
we
we're
can,
not
we,
at two yet.
no, we not. We like, I don't know,
You was a
like an
little bit
hour and a
after
half.
7,
Yeah. So
so
it's like an
you
hour
was
and a half. We got about 30 minutes.
close.
30 minutes left. I was close. I was just getting to the crib.
You put it in your
Um, I
calendar.
did. Uh,
That's why I put
Um,
the reminder on it for you.
nice. All right, let's see. Let's see. Blah, blah, blah. So,
Hello.
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 How are
Uh,
you?
good. Y'all caught me off
It's all
guard. I
good.
wasn't expecting to be
Like,
that
boom. There we
disruptive.
go. There it is.
Okay. You actually answered a couple of my questions while I was watching and stuff.
Good.
But okay, so I have probably about last time I checked 5 fibroids, 3 in the back of my uterus, 2 in the front. And they're on the outside, but now it's to the point like it's protruding. I have a little belly and stuff like that. I've been working out and stuff. It has helped a lot. Just hearing like stories from the other women, I am blessed to say that I don't have as many symptoms as they
Hmm.
have. But like even right now, like I'm kind of in pain because it's close to my period about to start.
Hmm.
So I get a little uncomfortable and pressure. Like I can push down and feel it a little bit and everything. But when I talked to a doctor, at first she told me don't get surgery. She was like, because I don't have any kids. I heard a young lady say that like she also got the same advice, but I don't have any kids and that it can damage my uterus and that it's just on the outside. I don't have to worry. And then randomly one day I went to go see her. She didn't check or update or anything. And then was like, oh, yeah, let's do surgery. So it kind of shook me because she at first was like, don't do it at all, and then randomly was like, let's do it. So I tried to go the natural way. And the only reason why I didn't continue that, well, I just wasn't disciplined. So I can't say that it didn't work at all. But the time period that I did do it, I did feel a little bit better. But I want to know, do I have to get surgery in order to handle this? Or is it can I continue to do the natural way? Or, is there somewhere else? Because I really don't want to do surgery.
Yeah, I mean, you don't necessarily have to do surgery. You got to ask yourself a couple of different questions. Number one, like, how old are you? All
I'm
right.
30.
And you are trying to have children soon, or
Yeah, yeah.
what's your plan?
Well, I just got engaged. So yeah, one day.
Gotcha. So I would really get a true assessment as far as like where those fibroids are located, right? So if those fibroids are pushing into the cavity of your uterus, then you have a problem. If they're not pushing into the cavity of your uterus, then you don't necessarily have to do much about anything. The fact that you're not having any symptoms is a great thing. To where it's like you don't have to urgently do anything. But women can have submucosal fibroids or fibroids that are pushing into the cavity, and not have a lot of symptoms that can happen.
Mhm.
So um, the answer to should you get surgery or not is not very direct. It really kind of just depends on the specifics of your fibroids and what you're trying to do. You have a lot of time, not a lot of time, but you have more time because you're young, um, to have children. Your fertility life is there. But if those fibroids are already starting to protrude your belly and they're larger, um, it really comes down to the point, are they pushing into the cavity? And
Mhm.
how large is large? Um, and those questions with answered can give you a better, you know, estimation on if you need to do anything about it. Look at it this way though. If they're starting to protrude your abdomen, they're not going to get significantly smaller. They can only get bigger. They may stay the same, but they're not going to just now make you have a six pack or a flat belly. So
Mhm.
you have to ask yourself, am I okay with my belly protruding like this? That even if they don't get bigger, am I okay with this for the remainder of my life or until, menopause? Like, am I okay with this?
Mhm.
Or, if things get bigger, what kind of position does that put you in? Um, so I would just really have to see with your ultrasound to kind of give you a better assessment. But just in a nutshell, I would say number one, if they're not giving you a significant amount of problems, you don't need to do anything right away.
Mhm.
But location wise, if they're pushing into the cavity of your uterus and you're serious about getting pregnant soon, that you should address them sooner rather than later,
Mhm.
because pushing into the cavity will decrease your ability to get pregnant, and it will decrease your ability to stay pregnant,
Mhm.
even if they're not causing you symptoms. So, getting somebody that's going to give you a true assessment and explaining those things really, really detailed to you is important.
Mhm. Is there something that can I still like work out, do natural things, eat and something so they don't grow until I get to the point of, deciding if I want surgery or not?
I'm telling, I would say yes. I would say eat healthy for your overall general health. I would
Mhm.
say absolutely work out, exercise for your overall general health. How much that will impact their growth, I can't promise you that,
Mhm.
because on the same token, I can tell you I operate on vegans, vegetarians, health experts, people that are in the gym all day, every day, people that don't have anybody in their family with fibroids. Like, you name the category, I have operated or am currently seeing somebody that's on my surgery schedule that fits into those descriptions.
Mhm.
So me telling you that now living a vegan lifestyle and that working out every day is going to stop the growth of your fibroids, I'm lying to you.
Mhm.
It sounds good. It sounds good for me to tell you. It sounds good for me to say, hey, sign up for my, you know, $100 course and I can make a meal plan for you that's going to help with your fibroids. I can get paid all day long like that. And I can make a huge amount of money by doing that.
Mhm.
But I'm not into that. Like, I'm into like being very realistic and to give you truth and answers, not trying to take your money.
Yeah.
So just be very careful. I don't discourage you from eating healthy. I don't discourage you from exercising. In fact, I encourage you to do it because I do it myself.
Mhm.
So for your overall health, absolutely. but I'm not going to tell you that that's going to stop the growth or going to diminish your fibroids, though. Just got to be realistic about what it's going to do.
And just a random question, what makes the fibroids grow?
Um, So fibroids are fed with hormones. So estrogen, progesterone, do well, estrogen more specifically will cause fibroids, can cause fibroids to increase in size. So notice I said can,
Mhm.
because you're not going to stop your ovaries from producing estrogen, progesterone. That they just going to do it. That's part of your life.
Yeah.
So with that being said, every woman with fibroids with active or working ovaries don't have to worry about their fibroids just getting excessively big. It doesn't happen for every woman like that. Everybody is a little bit differently. Why it impacts some women versus not impacting some women. Why some women can live with 2 and 3 centimeter fibroids for 10, 20, 30 years, and some women can have a 2 centimeter fibroid and then look up in 5 years and it's a 20 centimeter fibroid. The answer to that is unknown.
Hmm.
So there is no clear answer to it. So when people say, "Oh yeah, I did this and it did this for me," or I ate this and it made my fibroid shrink or go away," or "I ate this and my fibroid didn't grow anymore," like it's really kind of coincidental. It's not something that they can actually put their hand on and say that that actually works.
Hmm.
It's just their truth. But there's nothing that, you could just tell people that you can do this and it's going to make everything better for you. If I had the answer, I promise you I would give it to you, but it just doesn't exist.
Okay, and one more question, because I know people are waiting.
No problem.
Does alcohol affect it?
No,
Like, okay, because I've heard that
no.
before, that alcohol affects
I
it
got
and stuff.
I got people that and I promise you I'm not making this up. Like my surgery schedule is booked into April right
Hmm.
now with women that want myomectomy. So it's like the sample size is crazy. But I have women that have never touched alcohol a day in their life with 20 centimeter fibroids, right?
Hmm.
And I got women that drink every time they go out that have bleeding but have no fibroids.
Hmm.
So it's not I can't say that fibroids. Excuse me, I can't say, yeah, fibroids are just impacted by alcohol.
Hmm.
It's not true.
Okay. All right.
Cool.
Well, thank you so
You're very
much. It is
welcome.
appreciated.
Very
All
welcome.
right. Have a good
Most
night.
welcome.
Thank you.
All right.
Thanks for joining.
Thank you.
All right, so we're gonna screenshot and roll it over, or you want me to keep going?
No, keep going. Answer a few questions.
Yeah, I'm gonna take some of the submitted ones.
Okay.
Okay. Outside of taking spironolactone,
Spironolactone.
okay, are there other treatments for the hair growth on the face along the jawline with acne?
Um, yes. Well, one, you gotta, you can treat the underlying cause. So what this person is talking about is probably PCOS,
Yeah,
or
that
polycystic
their
ovarian
other question
syndrome.
was, is there a cause for it?
Yeah, so polycystic ovarian syndrome can do it, and it's a elevation of androgenic hormones or male type hormones or precursor to the male type hormones in the body that's causing male type facial hair growth pattern to happen. And spironolactone is a medication that, when taken, causes like the thinning out of hair, and the decrease of hair growth in those women. So there are other cream medications that are not on top of my head, but hey, there are creams that actually remove it, but more importantly, addressing the true issue, which is why there are androgenic hormones, or elevated androgenic hormones in the body. And so treating the underlying cause of the PCOS as opposed to actually the symptoms. So you could take the spironolactone until you treat those other causes, or you could just go right to it. So, you have elevated amounts of these hormones, but things like, with PCOS, uh, metformin, um, taking metformin, birth control pills, and also weight loss for most women that have, the heavier women with PCOS, those are treatments to treat the underlying cause to get the hormones normal, right? So that you don't have excessive amounts of estrogen in your system, or excessive amounts of insulin in your system that are throwing off your overall hormonal process that are causing these androgen or these male type hormones to be of high uh, value in your body. So treating the underlying causes would allow or would prevent these, the hair growth from being there, so you wouldn't have to take the spironolactone. So it's much more complex. That's a very complex question, but that's just a simple answer to it. That like yes, there are other medications, but the bigger thing is treating the underlying problem, so that you don't have to worry about it long term.
Okay. What minimally invasive procedures help with bladder control or incontinence, and what type of physician is it?
It just really depends on what the incontinence is from, right? So it's two types of incontinence. One is called stress incontinence. Stress incontinence is when you laugh, cough, sneeze, and lose urine. That's a structural cause that can be fixed surgically or sometimes even with physical therapy. And then you have urge incontinence, which is the urge to have to pee and the urge to have to go, but not being able to hold your urine to get to the bathroom, so you lose urine. That's not a structural cause. That is a medical cause, like whether it's a medication you're taking or medication to fix the issue. So it's just two different types of incontinence. It really depends on which one of those that you have will then address the treatment or fix the issue. A bigger problem that I see for women that have incontinence problems is what you drink, right? The little known fact is that I would say a lot of women that come to me with incontinence problems have a large caffeine diet. They're drinking teas, they're drinking coffees. Teas and coffees have caffeine in them. Caffeine is a bladder irritant. Bladder irritants will make you go to the bathroom often. Some women cannot control it, and they lose urine just because they have high levels of caffeine in their system that's causing irritation, which then is making them incontinent. Cut the caffeine, or change the bladder habits, where you, instead of waiting to go to the bathroom, now you're going and you're scheduling the way you go every 2 hours. You will improve the amount of incontinence that you have without surgery. So that's how to fix it without it. But in a nutshell, that's it.
All right. Um, if you do choose to have a hysterectomy, how will you know that you are in menopause?
Well, if you have a hysterectomy and you keep your ovaries, then you're not going to be in menopause. So your ovaries are what control menopause, not your uterus. So removing your uterus does not make you go into menopause. But to directly answer the question, they're saying like, well, if you're not having a period, how do you know that you went under menopause? Well, some women go through menopause, whether uterus or not. They may just, if they have a uterus, they may just kind of stop bleeding, but never have symptoms, right? So the only indicator that they're in menopause is that they're not having a period. But if they don't have a uterus and they don't have symptoms, the only really way of knowing that they're in menopause is to do, a hormone panel or check their hormones. But I would argue why it doesn't really make much sense. If you are not having symptoms, you're not having periods, there's really all it's just gonna say is okay, yeah, you're in menopause. If that's what you want to know, then great. But it's not changing anything. It's no management that you're gonna get, no medication that you're going to take to change the inevitable. Every woman is going to go through menopause at some point in time. Just like we're all going to die at some point, every woman is going to go through menopause at some point. Only certain women will actually have symptoms that show that they're in menopause. Other women will go through menopause and never have a symptom. I hope that answers that. Did I answer
I mean, I think that's the way they said
that?
it.
Yeah.
That
Yeah.
was the
So just,
submitted one,
okay.
so I think
So
that's
I hope that answered that. If you want me to dive into that a little bit more, just send Cola another one or like put that in the chat box and I'll try to uh go into that a little deeper.
Okay, this another submitted. What is the difference between Marina and UFE, and why was Marina discontinued? Marina, am I saying it right?
Morena? Minerva.
Oh,
Minerva? No,
I don't
I'm
know
trying to
that.
think. Minerva and UFE? I don't know if they saying that right. I don't know what they trying to ask with that.
Yeah, I could spelled it wrong. I mean, they could have spelled it wrong. I just cut
What did spell it?
Mirena.
Morena is the IUD.
So it's an IUD.
That's an IUD. It's not discontinued. I do Morena. I still do
Okay.
Morenas. Like you can people walking around with Morenas right now. Like so that's not discontinued, nor is UFE discontinued. Like you can get a UFE if you want to, even though I don't agree with it. You can get one. So I they have to resubmit that
Yeah,
one. I don't
I'll send it back because they could have. Yeah, all I did was cut and paste.
got you.
So all I did was cut and paste. So I don't know. All right. um, is preserving ovaries important when doing a hysterectomy at 50 years old, or is total removal recommended?
Very good question. So I look at it like this, and this is how I counsel patients. The younger you are when you have a hysterectomy, the more the benefit of preserving your ovaries is. So if you remove ovaries too early, you increase the risk of bone disease, heart disease, right? So when you do your hysterectomy, right, if you're 45 or 44, 43 or what have you, you still have a significant amount of ovarian life left. You don't want to remove them at that time because you're going to miss out and possibly have problems in the future. At a certain point, it's a risk versus benefit thing. So the younger you are, the benefit increases, the risk is low. The older you are, the risk of ovarian cancer starts to rise, rise. The older you are, the benefit of your ovaries starts to decrease, right? So at a certain point, your ovaries are going to stop working. They will be there, they'll or work very, very minimally. And so when you get to that point, the question becomes if you're doing a hysterectomy, does it make sense to remove the ovaries at that point, which then will decrease your incidence of ovarian cancer, which now takes that risk that keeps rising for every other woman, completely eliminate that risk. But, the benefit of them being there is not much. Do you just take them? And the answer to that is really specific for women. Some women just say, hey, I don't care if they're not working well, if they're not doing whatever. I just want my ovaries. That's fine. You can do that. But realize your risk of ovarian cancer doesn't change. It stays consistent with the general population. So, that's the same way of saying, like, do you just start taking out women's ovaries, everybody's ovaries, once they get menopause, so you could decrease the risk of ovarian cancer? No, you do not. If you don't have any problems, then women keep their ovaries. But if you're already in there and you're doing a surgery to remove the uterus, the question is optional whether to remove your ovaries at that time. If you don't want to have that risk, if you want to completely eliminate that risk of ovarian cancer, but not at the same time increase your risk of heart disease or bone disease, absolutely take it out. But if you just want to keep your ovaries just to keep them, it's totally your call. My mama, my auntie, my anybody in my family, if they get 50 plus and they need a hysterectomy, which they have not, I would absolutely recommend them removing their ovaries at that time because it's just not giving benefit. I don't want to have to take my mom who actually has her uterus, who has her ovaries, and may have the threat of ovarian issues in the future. It's possible. Um, that doesn't mean she needs surgery, but if we go in there to take her uterus, take her ovaries too. Because that's one less thing she has to worry about. It we have to worry about as a family, and it's not giving her a benefit. Please take them. So
Okay, someone in the comments said, I was really interested in when you mentioned about fibroid removal may not cure heavy bleeding. Can you elaborate a little bit more on that?
sure. So fibroids don't always cause heavy bleeding, right? 80% of African American women have fibroids, whether they be small, big, large, and different. Like damn near all women have fibroids. Not all of them, so don't quote me as saying that, but many women have fibroids. So out of those women, not all of them have bleeding because of the fibroids. So I can have a 40-year-old woman that has two 40-year-old twins that have, bleeding, and one of them has fibroids, one of them does not. So me saying that the one with fibroids, her sole purpose is on her sole reason why she's having bleeding is just her fibroids, doesn't make sense if her twin is having bleeding and doesn't have any fibroids, right? So just saying that treating fibroids or removing fibroids is always going to fix bleeding is not true. You have to really see if those fibroids are causing a problem. And typically, those are the fibroids that are pushing into the cavity of the uterus that are causing the issue, or close to the cavity of the uterus that are causing bleeding. But if they're not doing that, then chances of them causing significant bleeding are not high.
All right. So can you tell the people again where you located?
Okay, yeah, I guess we're gonna have to cut it because
Yeah.
we're close.
Yeah.
So I am now solely at working through Mount Sinai Hospital in Chicago. My clinic is on 11th and Kedzie, 1108 South Kedzie. Yeah, that's where I'm at. I am in Chicago, Illinois. So for anybody that wants consultations or want to talk to me about all this stuff and wants my opinion about it, if you're not here, if you are here, if you can drive to me, like right now, I got a woman that's coming from Florida just to come and see me. You can use your insurance. It's absolutely no problem. I'm all for it. Like you can come see me and utilize your insurance, no problem. As well as surgeries, you can do that same thing. But as far as like virtual consultations, you all over the country, you go to the website for virtual consultations. I do those again on my own time. I don't put you on time limits. If you got questions, just like now, I'm sitting here just talking about everything in depth and detail. I do the same thing with virtual consultations. When women have questions, it just gives you an opportunity to schedule it on your own time and be able to ask me as many questions as you want to ask me. So that website is there. It's pinned. But yeah, that's where to find me. If you're in Chicago or you want to fly to Chicago, whatever, just reach out to me. I definitely can put that number out there. I don't put that number out there regularly because when I do, people from New Haven, Connecticut want to call and say, I want to set up a virtual appointment. And my office has to tell you, no, just go to the website because my clinic days just become just over just drawn with all these virtual consultations. That's why I've just taken those virtual consultations out of my clinic for the first appointment. But if you want to come see me, you can. They can schedule you. But virtual consultations, if you can't come see me, then go to the website and schedule it.
Absolutely. Well, I think we should cut it because I don't want to get cut off and then our
All
video
right.
be like stinky.
So let's do it again next week or 2 weeks. Like, if everybody has, like, I'm sorry we didn't get to the people that was trying to get on here virtually.
Oh yeah,
So
let
very
me
sorry.
I'm gonna
Yeah,
take
take
because I marked the ones I answered. Let me screenshot the ones I
and
didn't. Hold
I'm
on
gonna
one
take
second.
I'm gonna take so Jewel Earth, Miss Pearls, uh Mitchell Love, McConna Johnson Brown, and Keep Calm and Pray. Like, so those are four. Like, I promise you, we'll do this again next week, and you guys will be the four people that will be on here first, and I promise we'll answer your questions.
Well, I don't know next week
Or
just yet, but
2 weeks,
yeah.
whenever you can,
But
whenever you can, we could.
we definitely gonna do it. Not gonna wait a full month. That's what I was trying to
For,
say.
for sure.
We definitely don't have to wait a full month. It just was real busy at the end of the year. Hold on one second. I marked the ones so I'm screenshotting the ones I did.
Yeah. And so, and to those people that were in there, if you got a question, just DM me. I'll answer it. If you need a question now, because I did promise, like if you were just on here and we're trying to get your question answered and I didn't get to you, then I'll answer it myself. So just send a DM out to me.
Yeah. And then, like I said, I do keep these questions so it rolls over because again, we limited to the time that Instagram gonna allow us. We definitely had a lot of people joining,
Yeah.
and like I said, we try to do it minimum once a month, but we'll do another one. We'll double up for January. That's our present. That's our holiday gift.
Holiday gifts. Happy New Year to everybody.
Yes, Happy
And
New
we'll see
Year,
you last time.
everyone.
We
And
we, we
thanks to
love.
everybody.
Yeah,
And
for sure,
definitely bring a friend with y'all next time.
for sure.
Invite somebody, share. If you join the live, send a thing to share it with a friend and say, hey, I'm in this live. You join it too.
Yeah, because you guys' involvement and like your participation was like super dope this time. It makes it so much better when you guys are into it. So super dope. As long as you all want to listen to it and hear stuff, then absolutely, I'm here. I'm here to get the information.
Yep,
So super
absolutely.
dope. All right, guys.
All right. Well, we
I'll
appreciate you.
be posting this. If there's questions and stuff you missed, just check my page. I'm gonna post it. Cola will post it on there. She'll do YouTube as well. So just be looking out for it. But it's a lot of good information in here. So please share it. Please check it and listen to some of these answers.
All
All right.
right. Thanks a
All
lot.
right.